My name is Chigun Thomas. I'll be presenting the second case of our ground round today. So, I'm presenting GC, a 19-year-old female from Katanga, a Congolese, Anglican by faith. The mother, ZE, was the next of kin, admitted to the ward, that is 4C, on the 4th of November this year. The presenting complaint was a 3-day history of fever, which was high grade, with vomiting. Okay, the history presenting complaint, this patient is a patient who was diagnosed and is having rheumatic heart disease together with mitral regurgitation, diagnosed in early childhood, and currently is on that medication, that is digoxin, furosemide, captopril, carvedilol, and spironolactone. Now, for this current admission, she had come in with high-grade fevers, which was associated with chills, and vomiting, which was non-projectile, and it was always after feeding, although it was also noted that it had been preceded by nausea at any time of the day, with 1 or 2 loose motions that were reported a day. However, other concerns which she had come in earlier with, or she had been with, as in one, she had a small body build, which was associated with general body weakness with poor appetite. Second, she had abdominal distension with no constipation and had no malnutrition. And the third was she was always complaining of palpitations, chest pain, orthopnea with no cough, sorry for repetition, and lower limb swelling. She reported that she had been adhering to her drugs all through the time she has been diagnosed with this condition. We'll start with the family history. She's a fifth born of 6 siblings. The eldest had died of an HIV disease in 2007. The other 4 are healthy, none are educated beyond primary, and all had left home, apart from her. The mom is a maize vendor around Mulago and Katanga. The father, who had abandoned the home in 2013, was also having history, quote, alcoholic history. That I can only quote because of what this young girl told me. Medical, surgical, and gynecological history is as follows. Medical, she had been, of course, admitted numerous times on a cardiology ward because of her condition. And this was because of the exacerbation of cardiac failure. However, there was no history of smoking or alcohol in this lady. And there wasn't any record of her taking any prophylactic antibiotics. Surgical, nothing was remarkable. There was no surgeries. And she had no history of blood transfusions. Past gyne history, she's a 19-year-old girl who hadn't got any menarche. And the diet, most times, just not in the gynecologic, but this is the dietary history, consisting mainly of rice, nuts, maize, posho, and occasional milk. And as I said, the father had abandoned. These are refugees who are getting by, and she was getting as much as what the mother could get, and that's mostly the maize, once in a while, rice and nuts for her meals. So, psychosocial and spiritual assessment. She comes from a poor and disunited family, stays with the mom alone even with her condition, and she helps out housework. And she was glad, as you see the quote, I'm able to do housework with minimal exertion and fatigue while my mom is selling the maize. And she was actually what she was quoting, that she was able to do all this even when she had elder siblings who were not able to help the mother. So this quote came out, you could see she was really, happy to know that her mother is happy that she's able to do this for her. She also told me as in that she was told that surgery would be a better option, but of course she couldn't afford. She had gone via televisions and radio stations seeking help, which was futile. She was a very prayerful woman or girl, and she, as you see there, I quoted her saying that I believe in miracles and they happen. So I believe miracles happen, and that one day God will hear my prayers and heal me. And she was saying as in why she admitted all the time, because she loves to stay in church and pray and pray and pray, because this will get by at one time. So exam. This was a young girl who was cachexic. She had prominent zygomas, obvious rib cage. She was febrile, temperature of 38.1, mild pallor and jaundice, tinge of jaundice. She had no dictoclubbing, no pededema. Her weight was 30, height was 140 with a BMI of 15. The CVS, the pulse was 90 beats per minute. It was regular, and it was normal volume with a blood pressure of 105/70. She had no raised JBP. The pericardium was hyperactive. The apex moves had moved to the 7th intercostal space, away to the mid-clavicular line, with a pan-systolic murmur which was loudest in the mitral area, radiating to the accusator. Respiratory system, she was statopenic at 28 beats per minute. The oxygen search was 95. The trachea was central. She has equal chest movements and normal air entry, although she had fine vessel crypts, and there were no rhonchi at the time when I examined her. Per abdomen, she had moderate distension, which was moving respiration, smiling umbilicus, but she had no other scars suggestive of surgery or cosmesis. There were no evident descended veins, and it was soft. She had mild tenderness over the right hypochondria, no guarding with a positive fluid thrill. The liver was ballotable, mildly tender, but I could not ballot the spleen or any other masses. So those are some of the investigations that have been done so far since she was admitted. That was a CBC which was done once, which showed a normal white blood cell count with differentials which were also normal. She had an HB of 8.9, which was a normocytic, normochromic picture, and the platelet count was 367. The blood culture was done, that is from our lab, showed no bacterial growth. The urine was normal, and the blood smear was negative, but surprising, it showed marked leukocytosis, which wasn't picked on the CBC. The renal function test and the liver function test had been ordered, but I couldn't get any results at the time when I clocked her. So, on the ward, she has been managed as, of course, a lady child with rheumatic heart disease with mitral agitation. And at the moment when she came in, they were querying that this could be an exacerbation, of course, of cardiac failure, together with query infective endocarditis. And the treatment, of course, included the anti-failure regimen, and this time they included antibiotics to counteract the infectious process. And of course, offering for managing the infective endocarditis. Thank you.